Dr. Gomez, sealants, dental sealants, in most cases they're done for children, but tell us whether they can and should be used for adults, whether they can and should be used at least for the second set of teeth while a teenager, gets them or so. How long do they last? Are they good at all? Who needs them? Who doesn't need them? Lots of questions, I know.
Yeah, we recommend sealants for every kid that has permanent molars in the mouth. And as soon as they come in, we like to protect the occlusal surface of the tooth with the sealants, because what happens, the kids eat some sticky candy, any food that goes in between the teeth, or not in between the teeth, but in the groove of the teeth. And by doing the sealing, you're gonna protect those areas from the food and the candies or anything that might stick to the teeth, and will prevent caries from developing. But that doesn't mean that any other, person cannot have it. Like the teenagers and adults also can have sealants if they wanted to prevent cavities from developing in the surface, on the occlusal surface of the tooth.
Okay.
And the sealant, I know you asked me how long that will stay. So usually we recommend to change it every 2 years, or make sure that the sealing stays in the mouth, and if they're not there, we replace them.
Okay, so basically they just kind of depends on the eating habits of the patient. They kind of might go away faster or slower, and you just check it, and if they're gone, so to say, worn out, like a carpet, I guess, or like any whatever it may be, a cloth, once it starts getting holes, you change it because it doesn't do the job anymore, and then you change it.
You have to understand that the sealing is not a filling. It's just like you clean the tooth and you place like an acid on top of the tooth to make some additions to the tooth by bonding something that we call sealant. It's a resin that goes on top of the tooth, but it's not a hole that you're filling. So that will bond to the tooth and stay on the surface. And if you're chewing a lot of sticky candy or hard food, that might come out, and then you need to replace them as soon as you notice that they're not there anymore.
Right. A sealant basically is for all purpose a protective plastic coating, so that the germs and the sugar stuff don't go to the actual tooth, and by doing so don't ruin it. Right?
Right.
Okay.
Right.
Now, would you suggest to have teenagers on their second teeth and adults sealants also? Maybe you mentioned it, but I didn't quite. I forgot it.
Yes, I did. We can do that in adult. If you see some patients, they are very, very susceptible to decay, so they get decay very, very fast, very quickly. Every time they come, they have some decay. So we might want to recommend them, sealants and also fluorides, because sometimes we tend to do that only on kids, but there are many adults out there that they might need it also because of the condition of the enamel that they have.
All right. Well, here we have it. Again, appreciate you talking openly with us about it. Thank you very much, Dr. Gomez.
You're very welcome.